Hey everyone, I am your super dentist and welcome back to my channel wherein we break down the dental topics in a way it's easy and stress free. Today we are tackling root canal, the procedure that has a very bad rap in movies as well as in online forums. If you have heard horror stories about the root canal being super painful or unnecessary, then you are not alone. The fact is, most of these are just a myth. In another few minutes, I am going to debunk top 5 myths about the root canal. So by the end of this video, you might be a bit more informed and less worried. So let's dive in. Myth number 1 is the big one, the granddaddy of all. The idea of the root canal being torturous and painful procedure. Now here's the fact. Root canal procedure is done to stop the pain, not cause it. Now think of it like this. The pain comes from your infected tooth, meaning the nerve or the pulp inside the tooth is either inflamed or dying. Now that is the real source of your agony. The root canal procedure is done under local anesthesia, meaning the area that we are operating is completely numb. Hence, you might feel some pressure, but you shouldn't feel any sharp pain. Most of the people say it feels no different than having a standard filling. The feeling that you get once the procedure is done and once the infection is completely gone is what it's all about. Myth number 2, why go through all this unnecessary procedure? Just yank it out. While extraction might seem cheaper and faster, it's always better to save your natural tooth whenever you can. Now the natural tooth is embedded in your jawbone, which helps protect the bony structure. When we pull the tooth out, the bone surrounding the tooth starts deteriorating over time. And moreover, to replace this missing tooth, you might have to go for a bridge or an implant, which is often more expensive as well as invasive procedure compared to the root canal and the crown you would have done otherwise. So saving your natural teeth is almost always the best investment that you can have for your health as well as your wallet. Myth number 3 is the weird and the oldest one. Now this myth comes from a debunked century old study which has been completely disproven by the modern science. Now there is absolutely no scientific evidence linking root canal with the illnesses in the other part of the body or even cancer. Now root canal treatment are safe and effective procedure. These procedures are done to remove the bacteria within the canal system and completely seal the tooth off. Now the procedure is done to remove the source of infection, not create one. The dentist and the endodontist wouldn't have done this procedure on the millions of people around the world if they were dangerous. Now coming to the myth number 4, many people imagine or picture root canal as a month-long ordeal. But here's the fact, root canal can be done in a single or 2 appointments. Now thanks to modern technology and techniques that it's possible, but the number of appointments depends on the complexity of the root canal system, but most of the time it is a single 60 to 90 minute visit. Now for a dentist it's a routine procedure and they have gotten incredibly efficient at it. Finally, the myth number 5, that you can skip root canal treatment by taking antibiotics or trying home remedies like oil pulling or garlic. Now these methods might help you prevent the symptoms or treat the pain temporarily, but it's not a fix for the serious tooth infection. Here's why. Antibiotic can fight infection for short term, but it doesn't remove the damaged or infected part of the tooth. Over time the problem can come back and you might end up needing the root canal anyway, or worse, you can lose the tooth too. And coming to the home remedies, they are good for the fresh breath, but they cannot reach the infection deep into the root canal system. The best way to avoid a root canal procedure is through prevention. Brush twice a day, floss regularly, and make sure you see the dentist once in 6 months. Now, if the decay is found out in a very early stage, then you might require a simple filling. But if it's advanced, then the root canal is the smartest choice that you can have to preserve your tooth as well as your smile. So let's recap. Root canal treatment are not painful, they are pain relievers. They save your tooth, which is better than pulling them out. They are safe, they are efficient, they can be done in 1 or 2 appointments. And finally, unlike the antibiotics or home remedies, which is a temporary fix, if done properly, root canal can last for a very long time. So if your dentist recommends a root canal treatment, don't panic. Ask them questions. They want to help you save your teeth and save your smile. The real pain is to leave with a painful tooth. So did any of these myths surprise you? If you have any experience of root canal treatment which was completely different from what you have imagined, then comment below so that at least it will help someone else to calm their nerves. If you found this useful, please give a thumbs up for this video and subscribe for more simple explanation about dental health. Thanks for watching, and remember, don't believe the myths.